Hi, everyone. Thank you for joining us. My name is Donna, and I'm with Genesis Fertility. We're so pleased to see that so many people are interested in learning more about donating their eggs. Egg donation is a special and generous gift, and the first step is understanding the process. Presenting tonight is Tamima Loeb, a women's health nurse practitioner who helps oversee the donor department at Genesis. She's going to walk you through the process step by step and answer any questions you have. I'm just going to ask you to please hold all questions until the end of the presentation. And without further delay, I'll turn the controls over to Tamima.
Okay, thank you, Donna. Hi, everybody. So like Donna said, we will be going over the egg donation process today, everything you need to know, and we will answer all your questions at the end. Okay, so I am a women's health nurse practitioner. I've been working in the field since 2015. I have experience working with egg donors and their recipients. With my own fertility journey, I do have a good understanding of what it means to go through the IVF process and to go through infertility, which helps and allows me to further enable my patients and women to feel understood and helpful through their journey. So in today's webinar, we're going to discuss the background of egg donation. We're going to discuss the criteria needed to become an egg donor and the process. Lastly, we're going to answer all your questions. Okay. So the first child born from egg donation was actually in Australia in 1983. Which if you think about it, 1983 is actually pretty recent. The field of egg donation has grown considerably in the past 40 years. And today, we have over 20,000 donor egg cycles a year. As you see in the slide, 1984 was the first American child born from egg donation. And it's astonishing how large the field is now and how many people are able to utilize this gift that you can give them where otherwise they would not have been able to become parents. So donating your eggs is one of the greatest kindness you can do for somebody else. It's really a selfless act of giving, which allows somebody who otherwise wouldn't have been able to become a parent. So this is something that is really important to keep with you throughout your donation process, and something to always remember that this kindness that you did for another person. It's really the key point in egg donation. Okay, so now we're going to go through kind of the technicalities and the criteria needed to become an egg donor. Now, most of these criteria are stipulated by the FDA, which is a government organization which creates the guidelines and the laws for egg donation. So you'll see that some of these criteria do differ from clinic to clinic, but these are the basics, okay? So you have to be between the ages of 21 to 32 years old, okay? The reason for this age limit is 1, fertility, and 2, you can't be younger than 21 because we want to make sure that you're autonomous and you're taking this on and responsible enough to donate your eggs. So the ages are 21 to 32. BMI must be less than or equal to 30. We want to make sure that you're healthy and in good shape to donate. You need to be eligible to be assigned temporary health insurance, so you need to have legal status in the USA. no personal or family history of serious health problems, no tattoos over the last 12 months. Now, if you have had a tattoo over the last 12 months, we would just need a certificate or a letter from the tattoo parlor or tattoo location where you got it done to make sure that it was within sterile conditions. Piercings is a similar issue. Must be over 6 months old. If you have a recent piercings, we need to have a letter stating that was done under sterile procedures. In addition, no high-risk behavior. An example of that would be excessive amount of sexual partners within the past 6 months, and no use of recreational drugs and specific injectable recreational drugs. Now, some reasons why a potential donor may be deemed ineligible or why they would be excluded. Some of these are just reviewed from the past slides. So behavior that increases your exposure to relevant communicable diseases, such as sexually transmitted infections. So that would be, excessive amounts of sexual partners, a personal or family history of serious health problems, and then failure to complete at least a high school level of education. Okay, these are just some examples. The egg donation process is outlined below, okay? And we're going to go through it step by step. The first thing you do is you send in an application. You do this online. There's multiple questions within the application that you have to answer. You send this in, okay? You should expect a call from the clinic, which will let you know whether you are approved or not, okay? Now, once you are approved, we will set up an appointment, a medical screening appointment. The purpose of this appointment is to determine whether or not you are physically able and physically healthy to go through the egg donation process, okay? So during this appointment, we will go over your medical history, your medications that you take, any illnesses. You will have a physical exam. This physical exam does include a gynecological exam and a transvaginal ultrasound. We will also do blood tests, which will look for any sexually transmitted infections, communicable diseases, okay? In addition, a drug screening is done. Once that is completed, we do have a psychological consult that you need to go through. Now, this consult ensures that you understand the emotional and psychological aspects of the donation procedure, okay? You would then have genetic testing. This will identify whether you are a carrier of genetically transmitted diseases such as cystic fibrosis or sickle cell anemia. The reason for this is we need to make sure that you are matched genetically correctly with a recipient. After that's completed and you are cleared, then you can complete consent forms and then begin cycling. When we say begin cycling is that once we match you with a recipient is a woman who you are donating your eggs to. This is all done anonymously, so your privacy will be protected. Then we will start with your cycle. Your cycle is when you start medication to grow an additional amount of follicles to be retrieved, okay? So when we say begin a cycle, we'll go through it now. What does a cycle mean, okay? A cycle means when you start your medication, okay? So this is just an outline and example of a egg donation cycle. You see in the top, it says cycle day number 1. Okay, cycle day number 1 is the first day of your period. The first day of your period, you will call the clinic and they will let you know to come in the next day for blood work and ultrasound. Once you come in, you will get a call from the nurses in the afternoon with your instructions. Your instructions will tell you when to start medication and what the dose of your medication will be. You will start the medication that evening and take it for about 14 days, okay? After the 14 days, 12 to 14 days, you will have your retrieval. During those 14 days of taking medication, you should expect to come in periodically for blood work and ultrasounds. Once your retrieval is scheduled, which will be anywhere between 13 to 14 days after you start your medication, we will tell you to come into our office for the retrieval. This is just a picture, a photograph picture of a digital picture of what the egg retrieval process looks like. So here you see a ultrasound probe that's placed in your vagina so that the provider can visualize your ovaries. That's how the provider can see how many follicles are the sacs which contain your eggs, are in your ovaries. Now, the purpose of going through a cycle with us, with medication, is so that we can grow many eggs, many follicles within the cycle. Okay, so you see the gray sacs in the ovaries are your follicles. Now, the provider places the ultrasound into your vagina so that they can visualize the follicles. Then a needle is placed and is attached to a suction. And the eggs are removed from the follicle through the needle that is connected to a suction. During this process, you are sedated, so you will not feel any pain at all. The process usually lasts for about 20 minutes. This is an ultrasound view of the ovary. The black circles are the follicles that we discussed. Within each black circle is an egg. Okay, so the recovery from the retrieval is pretty simple. We usually keep you in the office for about 45 to 60 minutes so that you can slowly wake up from your sedation and make sure everything is in order. You might feel some cramping or spotting, which is normal. Usually we recommend that you take Tylenol, Motrin, Advil. That usually relieves the cramping and pain. Most women can return to work the next day. You may experience some bloating for about 3 to 7 days after the retrieval, which should resolve once you get your period. Most women receive their period about 7 to 14 days after retrieval. Once you get your period, you call the office and we schedule an appointment with you. We call that the post-retrieval appointment. The purpose of that appointment is to go over any questions and to do an evaluation after you have donated your eggs. Now, potential risk factors to this process. So the largest risk factor that most people think of when undergoing IVF is something we call OHSS, ovarian hyperstimulation syndrome. Now, it sounds very big and scary. However, there is a very low chance of getting OHSS since we do very close monitoring and we dose very closely with your medication. Okay, now most women who experience OHSS, it is mild, and the symptoms are bloating and cramping and some fluid retention. So you might have some bloating, okay? Now, if you do experience OHSS, it's generally mild and it resolves once you get your period. There is a very, very, very low chance of more moderate to severe OHSS. Another risk factor is cycle cancellation, which could occur if the number of egg follicles that are growing is either too low or too high. That generally does not happen either. The third risk factor is infection and injury, which is extremely rare. But since an egg retrieval is a minor procedure, there is a slight risk of this. Okay. Now, one of the main concerns of women is, will donation affect future fertility? And the answer is no. Egg donation does not affect your future fertility, and we could go into that more by the question session if you want to delve into that. Now, compensation for donation is $10,000 per cycle, and the amount increases with each donation. So if you choose to donate a second time or third time, the amount does increase by $500 each time. Okay. Now I will leave the floor for any questions or comments from our participants. I know that some women want to know how many times they can donate, which is about up to 6 times. Okay, that's regulated by the FDA. That's the max amount of time you can donate. As most, as you know, most women are born with 1 to 2 million eggs. And then due to normal degeneration of eggs over time, by the time you hit puberty, you have about 300,000 eggs. And then after puberty, most women ovulate about 1 egg per month. So you average about 400 ovulations within your fertile window as a woman. Okay. Although 1 egg develops and is ovulated each month, you lose actually a lot more each cycle, which is through normal degeneration of the eggs. During the egg donor cycle, your ovaries are stimulated so that more than 1 egg develops. In other words, the medication taken during the donor egg cycle stimulates the development of some of the eggs that would normally just degenerate. So you're not losing any more eggs than you would have already. Okay? Usually with an egg donor cycle, the average amount is about 60 to 20 eggs, depending on how your body responds to, 6 to 20 eggs, depending on how your body responds to the medication. Okay, so you will have to stop birth control once you start cycling. You don't have to stop it leading up to it. We will let you know usually about 3 weeks before you start cycling. We tell you to stop it. If you have an ID, it can still remain in place. Okay, so initially, when you are going through the process of becoming an egg donor, whether we're seeing if you're eligible, we have to do FDA blood tests, which will include blood tests for STDs, which are sexually transmitted infections. Some examples are HIV, syphilis. There's also communicable diseases, which is hepatitis C, Hep B. So that's the initial blood test, including drug screening. The other blood test that you'll have to do initially is the genetic testing. Okay, so that's at the beginning. Now, once you're cycling, you will have to do blood work for your hormone levels. And that will be done periodically within the 2-week window of taking the medication. Usually it's just that day. So it does depend on the woman and how you respond to your medication. I would say anywhere between 10 to 25 eggs generally. So that's a very good question. We do anonymous donation. So everything is kept anonymous and you do not find out. 6 times max.